My name is Hope Murtaugh, and I'm originally from the Southeast, and I've lived in Greenville for over 20 years. We've raised 3 young men now. They are all grown and flown, and we're adding to our grandchildren ranks, which is exciting. When people ask me about cancer, I think the hope is that you only have one cancer story, that this is a one and done. Unfortunately, right now, I'm at cancer, 2. But I was diagnosed with my first cancer when I was 39. So our youngest was 3 years old, and our oldest was in 4th grade. Cancer hijacks your life completely. It's a very intensive experience, and hopefully you come out on the other end, even when you don't think you're going to come out at the beginning. I was diagnosed with stage 3 breast cancer. It was highly HER2 new positive, and it was already 8 by 9 centimeters. And that's about the size of a kitchen sponge if you trim off a little bit, make it more of a square. And it was in 4 of my lymph nodes, including one that was exploded with cancer. It was 2 centimeters. We did a mastectomy and lymph node removal right away. Then I went into chemotherapy, did 6 cycles of taxotere, adriamycin, and Cytoxan. And then went into radiation. And then I did a year of Herceptin, which is an immunotherapy targeting HER2 new positive breast cancer. So it was really kind of a 4-year process when my kids were really young. And then 7 years ago, I was diagnosed with stage 1 anal cancer. And I actually had some blood in my stool, which if you have that situation, you need to immediately get somebody to check it out. As soon as they did a colonoscopy, they saw that I had a small squamous cell skin cancer there that was bleeding. So you have this 8-millimeter cancer, but because of where it's located, you have to essentially drop a nuclear bomb on it, which does involve a standard chemotherapy and radiation. It's like trying to kill an ant on your kitchen floor with a nuclear bomb. That's a hard treatment. It's a hard treatment. As I've walked through these things over the years now, what is so important is how the healthcare professionals have gotten us through it all.
Hope was first referred to the Lifetime Clinic in 2015 for her history of breast cancer, which was originally diagnosed in 2003. The Center for Integrative Oncology and Survivorship was actually started back in 2012. We provide support for patients while they're going through treatment, but also for all the years to come. And that's also where the Lifetime Clinic comes in. So we follow them for life in their new oncology home, providing these services long-term. And then we try to manage delayed effects that they may have, things like pain, neuropathy, and anxiety, depression, lymphedema. We do have physical therapists who can help with that. And sometimes patients can even have cardiac effects that are results of certain chemotherapies, and even bone issues, sexual health issues. So we try to connect them up with all of these services that we offer for whatever is appropriate to that patient.
And what has been wonderful about the Center for Integrative Oncology and Survivorship is the intense detail to my quality of life. What is it that we can do, anything that we can do to help you live better with the side effects? Everything from, sessions on, sexual health to lymphedema management to just really following up well every year. It's a thoroughness that has been so helpful. My experience with Prisma care teams has been that they bring a unique level of humanity to the process for a patient that is really additive in a positive way to quality of life and to walking through the treatment path. It's been a great experience. Sounds stupid, right? My cancer treatment was a great experience. but if there's any joy and pleasure in it, it has certainly come from the people. I know that when I came out of my first cancer, I didn't want to be the same person. I wanted to be better. I wanted to be a little different. And I would say that we have one life, and we get to choose what we do with it. We really have a lot more freedom than we think we do. I definitely take more chances professionally. I do things. I go out on the limb a little bit more to connect with somebody, to maybe say what they maybe might need to hear. For me, the cancer journey has been very much tied in with my Christian faith. Cancer is the hardest thing I've ever been through physically, but it's been the most amazing thing spiritually. We have a choice on how we face these things. One of the things I would say to somebody newly diagnosed is to understand that you are bigger than your cancer. It's not going to define you.